Chapter 1. Difference between panic attacks and normal anxiety. The symptoms of panic attack include a racing heartbeat, sweating, trembling, a sensation of shortness of breath, choking, chest pain, nausea, stomachache, dizziness or fainting, derealization, depersonalization, a sense of losing control or going insane, an overwhelming fear of death, tingling or chills. Here in this guide, I will be taking you through all the important stuffs you need to know about panic attacks. The aim is to help you find a solution to panic attacks if it's something you or your loved ones experience. Remember that a panic attack is a single bout of worry, as opposed to generalized anxiety, which can continue anywhere from an hour to a lifetime. Anxiety manifests itself in the body in a variety of ways, including a racing heart, perspiration, tense muscles, and a rapid pulse. It's the sense that you're powerless to prevent anything horrible from happening. Almost everyone struggles with anxiety. Several media pieces have dubbed our era the age of anxiety. Worry is a constant sign that shows up in many mental diseases, but panic disorder is distinguished by an abnormally high amount of anxiety. It's amazing how many diseases have anxiety as a primary cause. OCD, PTSD, social phobia, GAD, agoraphobia, and drug-induced anxiety are examples of disorders in this category. Medication and a variety of psychotherapies are currently available, although they are not always sufficient. Those used to treat panic attacks are more effective than those used to treat other forms of anxiety. Panic disorder is easier to treat than GAD, OCD, and anxieties such as social anxiety. Panic attacks can be managed in a matter of days with an anti-anxiety medication like Xanax and an SSRI like Zoloft. Derealization and depersonalization. Derealization is a state of altered or distorted view of reality that panic attack victims experience. It's not unusual for people to believe they've entered another realm or are dreaming. Derealization can also occur in schizophrenics and people who have negative drug reactions. Panic attack patients are especially prone to the terrible symptoms of derealization because they are urgently grabbing at reality as it slips through their fingers. While depersonalization is characterized by a detachment between oneself and one's activities. Patients suffering from panic attacks frequently describe an outside-looking in feeling. The simplest way to deal with depersonalization is to persuade yourself that everything is fine and that you will return to your normal self. When you're terrified, your thoughts and body may become disjointed. Sit down and perform deep breathing while holding on to a firm surface, such as a wooden table, to swiftly restore your composure. Depersonalization seldom lasts more than a few days. Where do panic attacks originate from? Some studies believe that panic attacks are caused by a malfunction in the brain's alert system. There are a lot of adrenergic, adrenaline-like, neurons in the locus coeruleus. The axons of these nerve cells, which transport nerve impulses away from the cell body, reach into numerous areas of the brain, including the cortex, limbic system, thalamus, and hypothalamus. When there is a false alarm, the body experiences a spike of noradrenaline. When someone is suffering a panic attack, their adrenaline, epinephrine, levels rise, leading them to feel fearful even when nothing threatening is happening. Early humans perfected these biological systems in response to the need to immediately protect oneself from predators or flee from dangerous situations. As with any alarm system, it is prone to malfunction. Recent research has also connected panic attacks to abnormalities in the brain's GABA, G-aminobutyric acid, or serotonin systems. Contrary to popular belief, a patient's imagination does not cause a panic attack, but rather a chemical imbalance in the nervous system. Nobody knows for certain what causes panic attacks. The hippocampus is a long, thin structure on the ventricle floor that is a critical component of the limbic system. The limbic system is a group of subcortical brain areas that process and control emotional and motivational responses. It is yet uncertain whether or not this area of the brain has a function in panic attacks. Regardless, we wouldn't label someone who had panic attacks as brain damaged, even if their alarm system is faulty. We hypothesize that when antidepressants are used to treat depression, they reach the locus coeruleus and downregulate neuroreceptors there. Downregulation of receptors may be used to fix a dysfunctional alarm system. When antidepressants are used to treat panic attacks, Half of the patients say that their symptoms have completely resolved after a year. Why does my heart beat so rapidly during a panic attack? During a panic attack, the body experiences an adrenaline rush. Adrenaline works through the neurological system to stimulate the heart. The person's heart rate accelerates in order to provide them with the energy to fight or flight. Palpitations, a heightened awareness of the heart's beating caused by a change in the rhythm or tempo of the heart, are related with increased anxiety in the vast majority of patients. Cardiac palpitations do not indicate a specific cardiac issue. When patients report symptoms such as a pounding, racing, fluttering, or flopping heart, cardiologists may consider psychological causes. Anxious patients are more sensitive to changes in their heart rates and rhythms. Can I pass out as a result of panic attacks? While passing out is unlikely during a panic attack, dizziness is a typical side effect. Normal breathing should take precedence over hyperventilation, which can cause dizziness and fainting. Few patients have passed out on me during a panic attack, but it has occurred. The vagus nerve influences blood vessels, which may induce syncope or fainting. The great majority of healthy people have this form of fainting event. This is more likely to happen in a warm, crowded environment amid emotional stress. Fainting provides minimal risk unless one hits their head on anything. People frequently fear passing out during a panic episode, despite the reality that this seldom occurs. Having the person drink a glass of water will frequently keep them from passing out by diverting their focus away from their anxiety. Can childhood trauma cause panic attacks? Early trauma of any kind leads to the development of panic disorder by overstimulating brain areas that control the release of adrenaline and serotonin. Patients who have experienced childhood trauma commonly see their doctors, complaining of panic attacks. Once the panic attacks are under control, we may treat the underlying issues, such as childhood sexual abuse or neglect. Engaging persons having panic attacks in psychotherapy when they are in the midst of an episode is extremely difficult. Fortunately, there are a number of medications and other treatments available to help alleviate or even avoid panic attacks. We employ SSRIs and other antidepressants to treat panic attacks because we believe they can change the brain's stressed noradrenergic and serotonergic systems. These changes may be long-lasting and useful for those suffering from panic disorder. Nobody claims that we can repair the effects of brain injury, but that isn't necessary. Positive changes in brain chemistry might occur as an unintended consequence of psychotherapy and behavioral interventions. Keeping secrets about horrific situations like molestation from an early age can lead a person to be constantly on guard and apprehensive. Constant worry is taxing on the nervous system and can result in panic attacks and other symptoms. Agoraphobia and panic attacks. A sign of agoraphobia is avoiding the outdoors. Those suffering with agoraphobia are scared of leaving the protection of their homes, being in huge crowds, waiting in lines, crossing bridges, and using public transit or driving. Following panic attacks, a person may develop agoraphobia. Patients develop a phobia of going outside since it is associated with their panic attacks. Many people who suffer from panic attacks are afraid that if they walk outside on their own, they may pass out, go crazy, or become unable to function normally. When patients avoid social interactions, their ability to move about, work, and complete home tasks will become impaired. Chapter 2. Does drinking coffee or a lack of sleep increase panic attacks? By activating the brain, stimulants like caffeine and others may cause panic attacks. Once they have received therapy, patients may be permitted to continue drinking coffee, but they should abstain from caffeine-containing drinks during the first phases of diagnosis and treatment. Despite the absence of caffeine, herbal teas may still include substances like ephedra that may provoke anxiety attacks. Lack of sleep may cause panic attacks by elevating the body's hormone or other chemical levels. It's best to maintain as regular of a routine as you can while managing panic disorder, including going to bed and eating at the same times every night. Many people's panic attacks have been attributed to sleep deprivation. After receiving a diagnosis of panic disorder, you must put your health first. It's crucial to disrupt any unhealthy patterns you may have developed when you were young and healthy and replace them with positive ones like getting enough sleep and eating a balanced diet. It's not a luxury to get 8 hours of sleep every night. Should I abstain from alcohol if I have constant panic attacks? Patients sometimes claim that consuming alcohol triggers panic attack. Even yet, some claim that consuming alcohol may help prevent panic attacks. The objective is to keep your health at its best. It can be possible to moderately consume alcohol while using certain medications. Panic disorder is often treated with antidepressants. However, many of these medications shouldn't be used with alcohol. You may test out a little quantity of wine, half a glass, after eating, but not before taking your medication to see how you respond. If you're the kind of person who becomes drunk really quickly, you shouldn't keep drinking. You may, however, continue to take this modest amount on a weekly basis if you see little to no impact. It is not advised to take Ativan or any benzodiazepine when you have any level of alcohol in your system. Do women have panic attacks more often than men? It is yet unknown why men are more likely to have panic disorder with agoraphobia, while females are more likely to have panic disorder without agoraphobia. This can be the outcome of a particular hormonal effect on the brain. Despite being in the minority, many men nevertheless endure the harmful impacts of the illness. Men may also try harder to tough it out, using things like drink or drugs rather than reporting experiencing panic attacks. Also, no racial or ethnic group is more prone to panic attacks than others. Some individuals have panic attacks more often than others, while others minimize or entirely ignore them. Those from Southern Europe, Africa, and South America are more likely to develop a stiff upper lip attitude towards misfortune than those from Northern Europe and the majority of American culture. In Asia, persons with mental illnesses often experience societal stigma. In the past, some of these individuals may have even been locked up in an attic or a closet. Anyone having panic attacks will be discouraged from getting assistance if they receive such treatment and shame. In North American culture, panic attacks are stigmatized, and those who experience them often attempt to hide their illness. It is true that certain medications have distinct effects on persons of different ethnicities. For instance, Asians often need less medication than Europeans. These folks may have less active P450 enzyme systems in their livers. For whatever reason, Asians may be more adversely affected by, or even poisonous by what most people would consider small or regular amounts. Doctors should be aware of the variations in reporting across various ethnic groups and should thoroughly interrogate patients from societies that tend to downplay mental health problems. It could be required to get this information from other sources, such as friends, family, or other medical specialists. Age and panic attacks. Age does play a role, no doubt about it. Most people have their first panic attack between the time they're late teens and adulthood. In older people, this could be caused by health problems like hyperactivity or low blood sugar. Several people have said that panic attacks can happen later in life. Can therapy cure panic attacks? Many stress chemicals, including cortisol, are shown to go down after most types of therapy. By lessening the amount of these things in the body, panic attacks can be lessened. In therapy, people can talk about their thoughts, figure out what drives them, and figure out why they did what they did. Because of all of these things, panic attacks happen less often. Many people with panic disorder go to therapy for the first time before they realize they have a problem. When they feel strong feelings like anger at their boss, sadness over the death of a parent, or fear for the future, it surprises them. In modern North American society, these feelings are private, but therapy helps people figure out what they are. Some people have panic attacks because they can't deal with and talk about their feelings. Psychotherapy could also help people see patterns of behavior that might not be good for them. Chapter 3. Panic attacks and other related diseases. The signs of a panic attack may look like those of a lot of other health problems. One illness that can make a person feel nervous, irritable, or even frightened is hyperthyroidism, in which the thyroid gland is enlarged and makes too many thyroid hormones. This patient would need a blood test and at least a physical check from an endocrinologist to figure out that they have hyperthyroidism. Some people who have panic attacks may actually have diabetes, high blood sugar, or hypoglycemia, low blood sugar, which are often mistaken as panic disorder. Pheochromocytoma can cause people to have panic attacks. This syndrome is caused by a pheochromocytoma, which is a benign cancer of the adrenal medulla. This illness is very rare. Less than 0.1% of people with high blood pressure get it. The early signs of hypertension in these people are caused by the high amounts of adrenaline and epinephrine they have. When people feel these things, they worry that they are having a panic attack. It is important to have a medical expert, like a therapist, check the person having the panic attack to rule out any medical conditions that could be causing it. Psychologists and social workers may be able to help people who are having panic attacks, but they don't have the medical skills to rule out all of the other possible causes. The therapist can send the patient to another expert, like an endocrinologist, cardiologist, or rheumatologist, if that is what is needed. Most people who have panic attacks are healthy, but those who aren't need special care from a doctor. Do panic attacks happen at specific times of the day? They can strike at any moment, day or night, but people often experience them when outside, which can lead to agoraphobia. People with agoraphobia tend to suffer from panic episodes. A person with panic disorder should get help as soon as possible so that they don't develop agoraphobia. Panic attacks can be so severe that they cause people to wake up in the middle of the night. This is the scariest kind of panic attack. It's important to differentiate this attack type from sleep terror disorder. Anxious screaming during sleep is a common symptom of sleep terror disorder. The person is shaking, breathing heavily, and trembling with terror. The affected individual is insensitive to those who try to soothe them and often exhibits forgetfulness over the incident. Sleep disorder is characterized by a combination of panic attack symptoms, such as racing heart rate, shallow breathing, and profuse perspiration. Panic disorder versus generalized anxiety disorder. Generalized anxiety disorder, GAD, is characterized by persistent excessive concern along with restlessness, tiredness, irritability, and sleep difficulties, whereas panic attacks are more infrequent and episodic. In addition to forgetfulness, muscular tension, and an overall state of unease, GAD sufferers may have mental lapses. Patients with OCD worry about more than merely having panic attacks, being embarrassed in public, or being contaminated, unlike individuals with panic disorder, social phobia, or other anxiety disorders. Symptoms of generalized anxiety disorder often manifest themselves in early infancy. When treating GAD, SSRIs are frequently less effective than when treating panic disorder. Benzodiazepines are effective in treating both disorders, but provide more medical challenges due to the risk of addiction. Patients with GAD often benefit greatly from psychotherapy, which is why it is recommended that they seek out individual treatment as soon as possible. Chapter 4. Preventive and Therapeutic Measures. The best person to treat panic attacks is a psychiatrist. This doctor may provide treatment choices, including medication and counseling. Treatment for panic disorder may occasionally involve behavioral techniques. To change overt behavior, it makes use of a variety of techniques, such as systematic desensitization, relaxation training, participant modeling, and positive and negative reinforcement. A psychologist or social worker can conduct behavioral treatment and other types of psychotherapy, but unlike a psychiatrist, they cannot prescribe medication. The roles of a psychiatrist and psychologist are commonly confused. A therapist might be a layperson, someone without a degree. A psychiatrist, a psychologist, a social worker, a preacher, a rabbi, a nurse, or anybody else. The title therapist is not indicative of a therapist's level of education or training. Only a psychiatrist should issue a prescription for medication to treat panic attacks. This indicates that obtaining a medical degree from an approved institution of higher learning and passing a licensing exam given by a state medical board are prerequisites for practicing medicine. By investing additional time and effort in studying this branch of medicine, psychiatrists who have attained board certification in psychiatry are usually of greater service to their patients. Valium and Xanax for panic attacks. Both Valium and Xanax have a high potential for habit formation. They fall within the class of benzodiazepines. If at all, these medications should be taken with extreme caution. Additional examples of medications in this class are Klonopin, Ativan, and Librium. Because these drugs give quick symptom alleviation for those suffering from panic attacks, psychiatrists frequently prescribe them at the beginning of treatment. These medications shouldn't be used as long-term treatments for panic disorder because of their detrimental effects on the GABA system. The GABA system, also known as the gamma-aminobutyric acid system, is a network of inhibitory neurotransmitters present throughout the whole brain. Nerve cells shouldn't be turned off, inhibited, when the GABA system isn't working properly, which can result in overstimulation and unwanted effects like panic attacks. According to one theory, those who experience panic attacks may not have enough of the brain's natural benzodiazepines. Using Valium and Xanax should be kept to a minimum or avoided altogether. Antidepressants. Antidepressants are the most successful form of therapy for panic attacks. They won't make you high, but may have a number of advantageous impacts on your nervous system. The selective serotonin reuptake inhibitors, SSRIs, make more serotonin accessible to the neurons, which lessens panic attacks. This group of medications includes Prozac, Zoloft, Paxil, Celexa, Luvox, and Lexapro. Tricyclic antidepressants, TCAs, tofranil, and norepinephrine are also efficient. Certain brain receptors have more norepinephrine accessible to them, thanks to these TCAs. If at all, benzodiazepines should only be taken in small doses because they have a significant risk of misuse. An antidepressant is frequently initially prescribed by a psychiatrist along with one of these addictive drugs. Antidepressants can take 2 to 6 weeks to kick in, thus it may be necessary to take additional drugs like Xanax. Once the antidepressant has started working, benzodiazepines like Xanax can be progressively weaned off. A potential negative side effect of abruptly stopping Xanax usage is convulsions. Therefore, it is essential to see your psychopharmacologist, a psychiatrist who specializes in prescribing such drugs, before stopping or starting any prescriptions for mental issues. You shouldn't be concerned about taking medication if you are being treated by a licensed doctor. Since medications have a bad reputation, many individuals believe they should be avoided at all costs. Some look for natural ways to treat panic disorders. Although it is acceptable to utilize natural remedies to treat mental illness, they frequently fail to be effective. Why do some people recuperate from panic attacks, but others do not? It is unknown why some individuals can treat their panic attacks with medication and never experience them again, while others will continue to suffer from them forever. This suggests that after 1 year of treatment, half of those who take antidepressants for panic attacks will never experience another episode, while the other half will experience relapses. The most effective course of action is to continue taking medication for an entire year before discontinuing. In my experience, patients who attempt to wean themselves off medication in less than a year frequently experience a return of panic attacks. A combination of psychotherapy and medication is among the most effective treatments. Behavioral therapy. Behavioral therapy applies the theory of learning to the treatment of behavioral problems. During the 1960s, behavioral therapy was developed to replace anxious behaviors with healthier alternatives. Positive and negative reinforcement, biofeedback, relaxation training, flooding, and systematic desensitization are among the techniques used. The premise is that detrimental behaviors can be reversed through a reconditioning procedure. The term conditioning refers to a variety of techniques used to teach individuals new behaviors. Behavioral therapy can be used to treat anxiety attacks if the triggers for the panic reaction are identified. If a woman is prone to panic attacks on buses, behavioral therapy may consist of teaching her to calm her musculature, take deep breaths, and concentrate on positive thoughts while on the bus. The effectiveness of these methods depends on the individual employing them and the manner in which they are implemented. People with panic attacks can be taught to recognize a number of hyper-aware physical sensations, such as heart palpitations and tingle in the limbs and legs. Can I get cured of panic disorder? Although the progression of panic attacks over a lifetime has not been formally documented, it is generally acknowledged that the onset of panic attacks occurs between the ages of 20 and 30. Certain individuals can experience them very early or even as late as age 45. After the age of 50, many individuals report a decline or elimination of panic attacks. For some individuals, aging and increased stress may exacerbate panic attacks. There is no way to predict who will experience them for long or how frequently they will occur. DSM-4 follow-up studies indicate that after 6 to 10 years of treatment, 30% of patients are well, 40% to 50% are improved but symptomatic, and 20% to 30% are symptomatic and the same or somewhat worse. If you're not on medication, you should see a psychiatrist at least once per year and 3 to 4 times per year if you are. Psychotherapy sessions can be anywhere from once per month to 3 times per week. The best way to understand panic disorder is as a chronic ailment that may recur in times of extreme stress. As with all chronic illnesses, there are remissions and exacerbations. Chapter 5. The Neuroscience of Panic Attacks. Despite its usual link with psychosocial factors, panic attacks have a strong neurological base. Understanding the neuroscience of panic attacks requires investigating the intricate interplay between different areas of the brain, different neurotransmitters, and distinct neural circuits. The amygdala, a little almond-shaped region deep within the brain, is crucial in the processing of emotions, particularly fear and anxiety, and is thus at the root of panic attacks. When the amygdala detects a threat, it immediately activates the body's stress response system, which might result in a panic attack. It communicates with the hypothalamus and brainstem, which control the body's response to danger by raising heart rate, shortening breath, and secreting stress hormones. The locus coeruleus of the brainstem is also vitally involved in panic attacks. The locus coeruleus produces and releases the neurotransmitter norepinephrine, which regulates arousal and stress responses. During a panic attack, the locus coeruleus becomes hyperactive, releasing enormous quantities of norepinephrine into the brain and increasing vigilance and preparedness to fight or run. Gamma-aminobutyric acid, GABA, the brain's primary inhibitory neurotransmitter, also plays an important role in panic attacks. Simply explained, GABA is a natural tranquilizer that helps you relax and feel good. However, in persons with panic disorder, abnormalities in the GABA system frequently result in reduced GABA activity. By interfering with the brain's ability to manage anxious sensations, this discrepancy leads to the development and duration of panic attacks. The chemical serotonin influences how we experience and respond to stress. Reduced serotonin activity has been associated to an increased sensitivity to panic disorder, indicating that altered serotonin levels may play a role in panic episodes. Selective serotonin reuptake inhibitors, SSRIs, and other drugs that increase serotonin signaling are routinely used to treat panic attacks. Panic attacks have been connected to activity in the prefrontal cortex, the brain's executive control region. This portion of the brain houses higher-order cognition functions, such as decision-making and emotional management. However, during a panic attack, the prefrontal cortex may become overwhelmed, resulting in impaired cognitive processing and an inability to adequately control fear emotions. The neurobiology of panic attacks includes numerous brain networks. The fear circuit, which includes the amygdala, hippocampus, and prefrontal cortex, is critical in the creation and control of scared emotions. Disruptions in this circuit have been associated to exaggerated fear reactions and increased vulnerability to panic attacks. Genetics also influences the chance of experiencing panic attacks. The discovery of certain gene variants has revealed evidence of a hereditary component to panic disorder. The neurobiology of panic attacks is influenced in part by how these inherited factors interact with environmental triggers and stressors. There are multiple connections between various areas of the brain, neurotransmitters, and neuronal circuits that contribute to the neurobiology of panic attacks. The amygdala, locus coeruleus, GABA system, serotonin signaling, and prefrontal cortex all play roles in the development and expression of panic episodes. A deeper knowledge of the underlying brain circuits can assist in the development of effective medications and interventions for those suffering from panic disorder. In addition to its role in memory and emotion processing, the hippocampus is linked to panic attacks. According to study, those who suffer from panic disorder may have impaired hippocampus function or a smaller hippocampal volume. This may increase vulnerability to panic attacks by making it more difficult to understand and manage emotions. Glutamate and dopamine are two neurotransmitters that may be involved in panic disorders. Glutamate, an excitatory neurotransmitter, facilitates connections between brain cells and is vital in the regulation of fear reactions. Changes in glutamate levels or glutamate receptors have been associated to panic disorder. Dopamine, a neurotransmitter associated with motivation and reward, may influence anxiety episodes. Individuals with panic disorder have dysregulated dopamine signaling, which may contribute to the worsening of anxious and scared sensations. Panic attacks may be linked to the stress response of the body, which is mediated by the hypothalamic pituitary adrenal (HPA) axis. During a panic episode, The amygdala activates the hypothalamic pituitary adrenal (HPA) axis, causing the adrenal glands to release cortisol and other stress hormones. Chronically increased cortisol levels worsen anxiety and its physical consequences. Panic attacks have been related to neuroinflammation, which is an immune response in the brain. Pro-inflammatory cytokine levels have been associated to panic disorder. This adds to the growing body of research linking immune system dysregulation and chronic inflammation to the neurobiology of panic attacks and the development of anxiety-related symptoms. Although there is still much to learn about the neurology of panic attacks, it is critical to remember that they are multifaceted and multidimensional. New insights into the processes at work here are paving the path for more effective treatments and interventions for those suffering from panic disorder. The relationship between neurotransmitters and panic attacks. Anxiety episodes are caused by a complex combination of physiological and psychological variables, to which neurotransmitters play a crucial role. These chemical messengers impact numerous parts of the brain and body, including mood, emotions, and stress reactions. Serotonin is a neurotransmitter associated with panic attacks. Serotonin is a neurotransmitter associated with good feelings, such as satisfaction and well-being. Low serotonin levels have been related to anxiety and panic attacks. Low serotonin levels in the brain have been related to poor emotional control, as well as an increased vulnerability to anxiety and panic attacks. Another neurotransmitter linked to panic attacks is gamma-aminobutyric acid, GABA. GABA functions as an inhibitory neurotransmitter, reducing brain activity and boosting calm. Inadequate GABA or faulty GABA receptors may cause increased neuronal excitability and a mismatch between excitatory and inhibitory impulses. This may raise the likelihood of feeling nervous and experiencing a panic attack. Norepinephrine, another key neurotransmitter, is implicated in the body's response to stress. When the body detects impending danger, it produces this hormone to prepare for either the fight or flight response. In people who are prone to panic attacks, dysregulated norepinephrine release might result in an excessive and prolonged stress response. A chain reaction like this might cause panic attack symptoms like a racing heart, high blood pressure, and difficulty breathing. It is critical to understand that neurotransmitter interactions are complex and interrelated. When one neurotransmitter system is out of balance, it might affect others. Anxiety and panic episodes may be exacerbated by the influence of low serotonin levels on GABA and norepinephrine action, among other factors. However, neurotransmitters are not the only factors that contribute to panic attacks. Psychological and environmental factors also play a significant role. Knowledge of the role of neurotransmitters, on the other hand, can provide insight into the physiological mechanisms producing panic attacks, as well as future treatment approaches. Benzodiazepines and selective serotonin reuptake inhibitors, SSRIs, are two drugs that can be used to address neurotransmitter abnormalities and related symptoms. In general, anomalies in neurotransmitters such as serotonin, GABA, and norepinephrine play important roles in the development of panic attacks. These differences can impair emotion regulation, increase neuronal excitability, and contribute to heightened stress reactivity. Understanding the underlying neurochemical causes of panic attacks and devising management and therapy options necessitates an understanding of the complicated interplay between neurotransmitters. In addition to serotonin, GABA, and norepinephrine, several other neurotransmitters have been related to the onset and severity of panic attacks. Dopamine, a neurotransmitter associated with rewards and motivation, has been connected to how we perceive and interpret terrifying events. Anxiety and hypervigilance in the face of danger have both been linked to excessive dopamine bathing the brain. The primary excitatory neurotransmitter in the brain, glutamate, is required for message transmission between neurons. Excessive glutamate activity or insufficient regulation may result in overstimulation of brain circuits involved in anxiety and terror reactions, which may lead to the onset of panic attacks. Endorphins, the brain's naturally produced opioids, have also been demonstrated to have a role in stress and anxiety management. Endorphin levels may impact how the body reacts to stress, which in turn influences the proclivity for panic attacks. The intricate relationships between these neurotransmitters, aside from their unique activities, are amazing. Many neurotransmitters regulate one another's release. Disruptions in the delicate balance required for emotional regulation and stress response may increase vulnerability to panic episodes. Neurotransmitter anomalies can be caused by a variety of factors, including genetic predisposition, chronic stress, traumatic experiences, and medical illnesses. These imbalances can lead to increased sensitivity to triggers and more intense anxiety symptoms, making a person more vulnerable to panic attacks. The study of the role of neurotransmitters in panic attacks is ongoing, and new information about the underlying mechanisms is continually being discovered. This knowledge not only helps researchers better understand the complex biochemical pathways driving panic attacks, but it also informs the development of more effective medications that target certain neurotransmitters. Genetics and the surroundings can play a role in panic attacks. Changes in genes that control neurotransmitters, such as the serotonin transporter gene, SLC6A4, have been linked to anxiety and panic conditions. Genes can affect both how much serotonin is available and how much is taken back up. This can affect mood and anxiety. There is proof that genes involved in how the body responds to stress, like the corticotropin-releasing hormone receptor 1, CRHR1 gene, play a part in whether or not a person is likely to have a panic attack. Panic disorder can have their roots in a person's developmental years, in the form of stressful events or unstable attachment patterns. Post-traumatic stress disorder, PTSD, and panic attacks are both common responses to upsetting events like natural disasters, accidents, or physical attacks. There is a link between growing up in a stressful setting and having a higher risk of panic disorder as an adult. There are a lot of social factors that can make panic attacks harder to deal with, like family ties and cultural factors. Anxiety and panic can be learned if you grow up in a home where anxiety is common or if you see a close cousin have a panic attack. People's cultural views and societal expectations about how to deal with worry and anxiety could affect how often and how bad their panic attacks are. A person's way of life may also affect whether or not they have panic attacks. Alcohol, illegal drugs, and even stimulants like coffee can all make panic disorder worse or cause it to start in the first place. Substance abuse can make people more likely to have panic attacks because it upsets the balance of neurotransmitters, makes worry worse, and makes it hard to make decisions. Sleep problems like sleeplessness and sleep apnea have been linked to anxiety and panic disorders. Psychosocial factors like chronic worry, big life changes, or expectations at work can have a big effect on a person's tendency to have panic attacks. Chronic worry can cause the body's stress response system to be overstimulated. This can make anxiety worse and make panic attacks more likely. Stress and other bad things that happen in life, like the death of a loved one or money problems, can cause or make panic attacks worse. Genes and the environment are very complicated and depend on each other in many ways. Even though external factors can change how genes show up, genetic predispositions may make people more sensitive to environmental triggers. Due to the complexity and uniqueness of this interaction, it is important to have an integrated and specific plan to deal with panic attacks. By taking into account how genes and the environment combine in a complicated way, healthcare providers may be able to come up with individualized treatments to help patients deal with panic attacks and their causes. Chapter 6. The effects of panic attacks on mental health. People who have panic attacks usually feel mentally tired after having one episode. This episode could be very bad, causing a lot of worry and a feeling that bad things are about to happen. Panic attacks can be hard on a person's mind for a long time after the attack itself, leaving them with a constant feeling of unease. Remember that panic attacks are characterized by the feeling that you can't do anything. During an attack, a person may have a racing mind, a racing heart, trouble breathing, and other physical signs. This feeling of hopelessness and fear of another attack can make a person feel like they are always on edge. The mental toll of panic attacks is made worse by the fact that they are hard to predict. Because panic attacks can happen at any time, some people learn to avoid going to certain places or dodging situations that they have previously linked to attacks. Putting these kinds of limits on yourself can have important daily effects, like making you feel alone and lowering the quality of your life. The mental toll of panic attacks could lead to a number of psychiatric signs. People often feel guilty, ashamed, and powerless because they couldn't do anything to stop the attacks. They may also feel very weak or not good enough, and they may have a strong sense of self-doubt that doesn't go away. People may not be able to do anything else because they are afraid of having another panic attack. When someone has a panic attack, it often affects their interactions with other people. So, when trying to understand the fear of panic attacks, loved ones may feel frustrated, helpless, or even angry. This can make relationships hard and make the person having panic attacks feel alone. The mental toll of panic attacks can add up over time, which can lead to anxiety and depression. Chronic worry and stress caused by panic attacks can hurt a person's self-esteem, sense of safety, and overall mental health. It is important to see and deal with the mental effects of panic attacks. Help from therapists and counselors can give people the information, skills, and group they need to get over their anxiety and take control of their lives again. People can be emotionally hurt by panic attacks in a lot of ways. This can affect many parts of their lives. Even when things seem calm, it might be hard to relax or feel at ease because it causes a constant feeling of worry and unease. The worry of not knowing when a person's next panic attack will happen can hang over them like a cloud, making it hard for them to go about their daily lives. Panic attacks make people so scared that they can't do anything. It can make people feel like they can't do anything and are about to die. This kind of fear can make a person feel like they have no control, like they're trapped inside their own head or body. Their mental health could be forever hurt by the stress they went through, and, in the worst cases, they might even think about killing themselves. During a panic attack, people can feel a wide range of emotions. When they have panic attacks, some people feel humiliated or ashamed because they see it as a sign of weakness or failure. This kind of self-criticism can make you feel even worse about yourself and your confidence. They might feel deceived and angry at their own bodies for putting them through this. Panic attacks don't just affect the person who is having them. They can also affect their relationships with other people. Family and friends may not be able to understand someone having a panic attack if they don't know what's going on. Seeing someone you care about go through such extreme mental turmoil is hard, and friends and family often feel helpless in the face of it. In addition to the short-term emotional effects, frequent panic attacks could hurt a person's mental health in the long run. Stress and anxiety that don't go away can be bad for a person's mental health and make them lose interest in life. People who are afraid of having a panic attack might avoid or approach things they used to enjoy with apprehension. Most of the time, you need a whole-person approach to get over the damage that panic attacks do to your mind. Along with treating the noticeable signs, it is important to understand the underlying causes and triggers. Cognitive behavioral therapy, CBT, is a good way to treat a wide range of mental health problems. For example, it can help people change how they think about and react to difficult events. In some situations, medicine may be given to help lessen or get rid of symptoms. It's also important to have the support of people who understand and care about you, like friends and family. People who are suffering can find validation, encouragement, and a sense of connection in peer support groups, where they can meet other people who have been through similar things. Family and friends can help a lot by learning about panic attacks, being kind and patient, and making the person feel safe and supported. Typical emotions that come with a panic attack. As soon as a panic attack starts, the person who is having it may feel a sudden rush of great fear or dread. As they try to figure out what's going on, their thoughts may get jumbled and their mind may race. Their thoughts may be filled with the fear of dying or getting hurt soon, which makes them very careful. At the same time, a number of physical signs start to show up. This makes the mental pain even worse. The person may feel their heart beating so fast that it seems to be trying to burst out of their chest. After that, you'll start breathing quickly and feel like you can't get enough air or that your chest is getting tight. They start to sweat a lot and may feel like their limbs are shivering or shaking. They might feel shaky and confused because they are dizzy or lightheaded. It's easy for catastrophic thinking to take over the mind, which makes people always be ready for the worst. They might be in a position that puts their lives in danger, or they might be afraid of losing all control. Because of these views, people feel more afraid and like bad things are about to happen. When people feel like they can't handle their emotions, they may try to avoid things or protect themselves. They could look for support from other people, stay away from places where they've had panic attacks before, or cut themselves off from society totally. Even though these things are done with good intentions, They might keep the circle of panic attacks going by giving short-term comfort and reinforcing the idea that the things that are feared are bad. When the panic attack is over, the person may feel tired and relieved at the same time. But fear of more attacks can quickly make it hard to feel good. You can't get away from the worry that something similar might happen again. If someone starts to avoid situations they think might trigger another attack, their life might become limited and lonely. Repeated panic attacks and the thoughts and feelings that come with them can have a big effect on a person's quality of life. They might feel more worried than normal and find it hard to do the things they used to enjoy. It's possible that their ties with other people will put too much stress on them and hurt their health. People who have panic attacks should pay attention to how they think and feel and try to change them. With the right help like therapy or coaching, people may learn to deal with the symptoms and fight the negative thoughts that keep the panic attack loop going. Over time, a person's emotional health, sense of being in charge, and ability to deal with panic attacks can all get better. During a panic attack, it's normal for people to see and understand things in a different way. Catastrophic thinking is when someone sees harmless signs in their body as signs of a life-threatening disease or the end of the world. They might not be able to tell the difference between real dangers and their own heightened sense of danger. This type of cognitive distortion can lead to a vicious loop of growing worry and becoming more aware of how your body feels. Also, tunnel vision is a common thing for people who are having a panic attack. Their attention turns inward, focusing on their own feelings, such as body pain and fast-moving thinking. This attention to detail only makes the feeling of fear worse and makes it harder to connect with the real world. During a panic attack, a person's fear may not match the real danger. You might feel like you're going crazy or that you're losing control of your life. A scary feeling that one's life is in danger is another familiar mood. All of these mental and physical responses help keep the circle of terror going. Panic attacks don't just make people scared. They can also make them feel ashamed, guilty, and embarrassed. People who have been attacked often feel ashamed of their responses and how their pain shows on the outside. It's possible that they'll feel like they're not as good as other people because they can't handle problems that other people seem to handle with ease. Because of these worries, a person might pull away from others and refuse help. Also, panic attacks can cause worry before the attack. People who are afraid of having another panic attack can be on edge and on high alert all the time. The fear of having another panic attack can have a big effect on a person's day-to-day life and make them less likely to do things that they used to do during attacks. It's important to remember that different people have different mental and physical responses to panic episodes. People who have panic attacks often also have depression. Even though the two seem very different, both panic attacks and depression can cause feelings of hopelessness, changes in hunger, and an inability to focus. People who have both panic attacks and depression may feel even more swamped by their feelings and lose interest in things they used to enjoy. Post-traumatic stress disorder, PTSD, and panic attacks are two mental health problems that often go hand in hand. After being exposed to or going through a stressful event, people with post-traumatic stress disorder are more likely to have panic attacks. Anxiety and panic attacks can be brought on by thoughts, feelings, or physical reactions that come from remembering the scary event. Because panic attacks can make people feel more scared and make it harder to get trauma-focused treatment, people with both PTSD and panic attacks can find it hard to deal with their painful memories. Problems with panic attacks and addiction to drugs have been linked. Some people use drugs or drink as a way to deal with the extreme fear and sadness that come with panic attacks. But using drugs or booze to deal with worry can make panic attacks worse and make the person more likely to become addicted. When this happens, it's important that help focuses on both the panic attacks and the drug use. Even though panic attacks often happen with other mental health problems, it is important to note that they can also happen on their own. The way that panic attacks and other mental health problems affect each other may be different for each person. But proper diagnosis, effective treatment planning, and comprehensive care all rely on knowing how panic attacks and other mental health conditions that happen at the same time are linked. People with panic attacks can better control their symptoms, improve their health, and live better lives if they also get help for their underlying mental health problems. Both panic attacks and obsessive-compulsive disorder, OCD, are mental illnesses that often happen together. People with OCD may do things over and over again, which are called compulsions, to stop their thoughts from rushing. When a person with OCD can't follow their habits or can't do their obsessions or compulsions, they might have a panic attack. When OCD and panic attacks happen at the same time, the signs of both can get worse. Borderline personality disorder, BPD, is characterized by extreme emotional instability, bad relationships with other people, and acting on impulse. People with borderline personality disorder often have panic attacks, which can be caused by thoughts of rejection or being left alone. It's possible that the mental upheaval and the use of bad ways to deal with things could get out of hand because of these panic attacks. Eating illnesses like anorexia, bulimia, and binge eating disorder and panic attacks are not mutually exclusive. Panic attacks have been linked to feelings of anxiety and worry about how one looks, changes in weight, and eating habits. People with eating disorders can have panic attacks because they are afraid of gaining weight, feel guilty after binge eating, or are worried about following strict eating rules and routines. Many times, anxiety attacks and other mental health problems happen at the same time. This doesn't mean that one condition causes the other, though. Instead, they are often caused by similar risk factors, such as genetics, brain problems, or stress from the surroundings. By learning more about how panic attacks and other mental health disorders affect each other, doctors can better tailor treatments to the needs of each patient and deal with underlying problems. Chapter 7. Managing Panic Attacks Through Exercise. Among its many benefits, exercise reduces tension and anxiety levels immediately. In response to physical exercise, endorphins, also known as the feel-good hormones, are released, resulting in a state of serenity and contentment. People who experience panic attacks may find that exercise helps by diverting their attention from the attack to the sensations and movements of their bodies during the exertion. This shift in attention has the potential to interrupt the anxious cycle of thinking and restore serenity. Those who experience heart palpitations or a rapid pulse rate during panic attacks may find that engaging in regular physical activity alleviates these symptoms. Aerobic exercise, such as jogging, swimming, or cycling, is beneficial for a person's heart, blood vessels, and cardiovascular fitness as a whole. This can help you feel more in control of the somatic sensations that accompany panic attacks and reduce their severity and frequency. The benefits of exercise for managing with panic attacks are not limited to the short term. Physical activity has been shown to enhance sleep, decrease depressive and anxious symptoms, and increase self-confidence. The interaction between these variables in panic disorder has been linked to both the frequency and severity of panic episodes. Through regular exercise, individuals can develop a healthful lifestyle that is beneficial to their mental health. People with panic disorders may benefit tremendously from the structure and regularity provided by exercise. The establishment of a consistent exercise routine can cultivate a sense of stability and mastery in one's life. By providing a sense of stability and predictability, a consistent schedule may help reduce the frequency of anxiety episodes. Although aerobic exercise is typically recommended, the benefits of any physical activity cannot be exaggerated. Participating in activities such as yoga, tai chi, or dance can aid in the management of panic attacks by promoting relaxation, mindfulness, and body awareness. Regular exercise and other forms of physical activity ultimately play a significant role in preventing and managing panic attacks. Exercise has numerous positive effects on mental health, including reducing anxiety, improving cardiovascular health, establishing routines, and enhancing one's demeanor. People with panic disorder can enhance their ability to manage and contend with panic attacks by engaging in regular physical activity. Physical activity has been shown to reduce the physical effects of stress. This may help reduce the levels of stress compounds such as cortisol and adrenaline that are typically elevated in anxious individuals. By reducing levels of stress hormones, exercise can help control the body's physiological response to stress, resulting in a more tranquil and stable state of being. Physical activity not only has direct positive effects on mental health, but also on physical health. Regular exercise has been demonstrated to improve immunity, vitality, and general physiological function. When a person has a strong sense of physical health and well-being, their capacity to control and manage with panic attacks improves. People with panic disorders may benefit from the social opportunities and support provided by exercise. Participating in group fitness classes, joining a sports team, or even simply exercising with a companion can help you meet new people and strengthen existing relationships. During a panic attack, having peers or family members to rely on can provide much-needed emotional support, inspiration, and a sense of community. Exercise is an excellent method to release tension and negative emotions, while also providing a welcome distraction. When exercising, individuals frequently pay heed to their own body's movements, cadence, and sensations. Typically, panic attacks are accompanied by a cycle of worry and rumination, but refocusing on the present moment may help break this cycle. A holistic, individualized approach to physical activity is essential. Despite the numerous health benefits of sustaining a regular exercise routine, it is essential to respect one's own physical limitations. It is recommended to commence exercise at a moderate intensity level and gradually increase both the intensity and duration as time passes. Individuals with panic disorder may benefit from advice from a medical professional or certified fitness instructor regarding safe and effective exercise programs. Dietary considerations for panic attacks. Diet plays a significant role in both the management and prevention of panic attacks. Certain dietary choices can either exacerbate or assuage feelings of anxiety and panic, so it is essential to consider how our eating patterns impact our overall health and happiness. Consumption of stimulants, such as coffee and alcohol, is a crucial factor to consider. Both chemicals have been linked to panic attacks and other anxiety disorders, either as causes or as aggravators. Caffeine is a stimulant of the central nervous system found in numerous foods and beverages. It can increase your pulse rate and make you feel more vigilant. Those who are already susceptible to panic attacks may experience feelings of agitation and anxiety after taking it, thereby increasing the likelihood of an attack. When planning a diet, it is also important to consider how different substances influence blood sugar levels. Blood sugar fluctuations have been linked to anxiety and panic attacks. When you consume meals high in refined sugars and carbohydrates, your blood sugar levels rise rapidly and then decline abruptly. This fluctuation in blood sugar causes you to feel feeble, irritable, and anxious, and can even trigger a panic attack. Magnesium, vitamin B12, and omega-3 fatty acids are among the nutrients that have been linked to anxiety disorders. Both magnesium and vitamin B12 are involved in the production of mood-regulating compounds in the brain. Anti-inflammatory omega-3 fatty acids, which are present in foods such as fatty seafood, walnuts, and flax seeds, may aid in anxiety relief. In recent years, there has been an increase in interest in gastrointestinal health and the gut-brain axis. According to recent studies, anxiety and panic disorders have been linked to disruptions in the gastrointestinal microbiota. Fruits, vegetables, fermented foods, and yogurt are examples of prebiotic and probiotic foods that can support a healthy intestinal microbiome. A nutritious diet may have positive effects on mental health, including the capacity to control panic attacks. Although dietary modifications may be helpful, they are not a panacea for panic attacks. Each individual is unique, so it is essential to consult a physician or dietitian to determine the best method to manage anxiety and panic attacks. In addition to the direct effect of particular foods and nutrients on panic attacks, other dietary factors may indirectly impact mental health and contribute to the occurrence of panic attacks. Food allergies and intolerances are essential considerations. It's conceivable that some individuals are unaware of their sensitivity to foods containing gluten, dairy, or certain substances. Due to the inflammatory responses prompted by these sensitivities, anxiety symptoms, such as panic attacks, may develop. To reduce the likelihood of panic attacks, it may be beneficial to identify and eliminate food triggers using an elimination diet or under the supervision of a healthcare professional. Additionally, the availability of a wide variety of nutrients and the overall quality of one's diet may influence one's mental health. Cognitive and emotional health are supported by the vitamins, minerals, and antioxidants found in whole, unprocessed foods. However, anxiety symptoms may become more severe if a diet high in processed foods, unhealthy lipids, and desserts is consumed. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats has been demonstrated to enhance mental health and reduce anxiety and panic attacks. When and how frequently you consume may also influence anxiety levels. Having a low blood sugar level can cause irritability, dizziness, and anxiety, particularly if you miss meals or go for extended periods without consuming. Maintaining a regular eating schedule and consuming nutritious treats throughout the day will help maintain stable blood sugar levels. It is essential to observe that people's reactions to specific foods may vary greatly. Some individuals who experience panic attacks may benefit from avoiding certain foods, while others may not notice a difference. It is essential to tune into your body's unique responses and collaborate with a trained professional to find a solution that works for you. Panic attacks and healthy sleeping habits. Good sleep hygiene can reduce the frequency and severity of panic attacks significantly. Neglecting proper sleep hygiene may result in inadequate or poor sleep quality. This can increase the probability of experiencing panic attacks. Sleep deprivation and disrupted sleep patterns can have negative effects on a person's disposition, level of anxiety, and susceptibility to panic attacks. The occurrence of panic attacks is directly influenced by a number of crucial aspects of sound sleep hygiene. Consistently adhering to a bedtime and rise time synchronizes the body's internal schedule, promoting a healthy sleep-wake cycle. Regular slumber reduces tension and anxiety, which can help prevent panic attacks. Establishing a conducive environment is an additional component of excellent sleep hygiene. A cool, dark, and silent environment is optimal for a restorative and comfortable night's sleep. Reduce or eliminate exposure to bright lights, such as electronic displays, in the hours leading up to nighttime for improved sleep. Better sleep hygiene, which can be achieved by optimizing the slumber environment, has been associated with improved mental health and decreased panic attack frequency. Creating a calming bedtime ritual may also be beneficial. Before bed, it is possible to reduce tension and anxiety by engaging in activities that promote relaxation, such as reading a book, taking a warm bath, or employing mindfulness techniques. These actions signal to the brain and nervous system that it is time to unwind, thereby reducing tension and facilitating a restful night's sleep. In addition to these measures, adopting a healthy lifestyle can improve sleep hygiene and the management of panic attacks. A regular exercise routine during the day results in better sleep, less anxiety, and increased general contentment. However, avoid exercising just before bedtime, as this may stimulate the body and make it difficult to fall asleep. In order to improve your sleep hygiene, you may want to avoid stimulants such as caffeine and nicotine in the hours before bed. Anxiety and panic attacks can be exacerbated by medications that make it difficult to fall asleep and stay sleeping. Prioritizing sleep hygiene enables individuals to improve their resting conditions, establish reliable twilight rituals, and adopt overall healthier practices. By implementing these adjustments, you can anticipate improved sleep, decreased anxiety, and fewer panic attacks. Although excellent sleep hygiene may be beneficial for some individuals experiencing panic attacks, it is not a substitute for seeing a physician. Consult a medical professional if panic attacks continue or significantly interfere with daily life. Keeping your bedroom at a comfortable temperature and humidity level is essential for proper sleep hygiene. This includes removing any potential sleep-disrupting elements, such as loud sounds and bright lighting. Those who experience nocturnal panic attacks may find that a tranquil environment makes them feel more secure. Setting a consistent bedtime routine is also essential. A regular bedtime and rise time can help establish and maintain a healthy circadian rhythm. Staying up late or going to bed whenever you feel like it can disrupt your body's natural cycles, leading to increased anxiety and even panic attacks. A routine of soothing activities before bedtime could be beneficial for both sleep hygiene and panic attacks. This is exemplified by breathing exercises, meditation, and gentle stretching. These exercises help individuals prepare their minds and bodies for a restful night's sleep. Additionally, consideration should be given to daily routines and lifestyle choices that may affect sleep and anxiety levels. Regular exercise can help manage panic attacks because it improves sleep quality and reduces anxiety. However, strenuous activity should be avoided in the hours preceding bedtime because it can stimulate the body. A healthy, balanced diet is also an essential component of excellent sleep hygiene. Ingestion of a large, high-fat meal or a stimulant, such as alcohol in the hours preceding bedtime, may impede sleep and increase the likelihood of panic attacks. It may be possible to improve sleep quality by avoiding hefty meals and beverages in lieu of lighter, more nutritious snacks. Technology also has a significant impact on sound sleep hygiene and panic attack coping mechanisms. The hormone melatonin that regulates sleep can be disrupted by the blue light emitted by electronic devices such as smartphones and tablets. A healthier sleep hygiene routine that includes limiting screen time before bed and making the bedroom a technology-free zone will aid in reducing nighttime panic attacks. Even if you employ excellent sleep hygiene, you may still experience panic attacks if the underlying cause is an anxiety disorder. If panic attacks persist or cause significant impairment in daily life, it is best to consult a physician or mental health professional for a thorough diagnosis and treatment recommendations. Stress relief techniques for panic attacks. People who have experienced panic attacks should prioritize learning stress management skills and pursuing a more well-rounded lifestyle. These techniques have been shown to reduce feelings of insecurity and assist in preventing panic attacks. By adopting a more holistic perspective, one's tension levels can be lowered and a healthier, more balanced lifestyle can be promoted. Self-care should be a priority. This requires giving one's mind and body the consideration they merit. Yoga, sprinting, and swimming are just a few of the numerous forms of physical activity that can enhance health and well-being. Endorphins, which are released during exercise, are compounds that improve mood and reduce tension. Meditation, deep breathing exercises, and mindfulness practices are also effective methods for relaxing the body and mind and reducing anxiety. Developing a consistent bedtime routine is also crucial. 7 to 8 hours of quality sleep per night has been shown to enhance health and stress resistance. To facilitate a restful night's sleep, keep the bedroom cool, dark, and silent. You can improve the quality of your sleep by avoiding stimulants, such as caffeine and electronics, in the hours leading up to bedtime. A balanced diet may be an effective instrument for combating stress. Eating nutrient-dense foods, such as fruits, vegetables, whole grains, and lean proteins, promotes both optimal cognitive function and emotional stability. It is best to limit or eliminate your consumption of added sugar, caffeine, and processed foods in order to maintain consistent energy and mental clarity. Along with these behavioral modifications, a robust support system is also essential. Sharing one's experiences and sentiments with trustworthy peers, family, or support groups can reduce feelings of isolation. It is also recommended that you seek professional treatment or counseling. Professional counseling may assist you in determining the source of your tension. Participating in activities that make you joyful and fulfilled is essential for maintaining a healthy lifestyle. Engaging in joyful activities, such as pastimes, time in nature, or time spent with loved ones, can reduce tension and improve well-being. Scheduled time for introspection, journaling, or other creative pursuits can serve as an emotional release and a means of gaining a deeper understanding of oneself. Those who have experienced panic attacks can reclaim their lives by employing these stress management techniques and striving for equilibrium. It is a never-ending journey that requires compassion and patience with oneself, but the pleasure and mental health benefits are immeasurable. Training in time management skills may be very beneficial. By breaking work into smaller, more manageable stages and establishing priorities, it is possible to avoid feelings of being overburdened and reduce tension levels. It is possible to live a more balanced and stress-free life through proper planning and the establishment of reasonable goals and deadlines. Self-expression and stress relief through artistic pursuits can be a potent combination. Indulging in creative activities, such as painting, writing, performing an instrument, or creating crafts, may be therapeutic and contribute to greater happiness. Positivity and gratitude may have a significant impact on a person's ability to cope with stress and appreciate life. Daily gratitude practice can help counteract the negative effects of negativity bias and promote an optimistic outlook on life. A healthy and optimistic outlook can also be fostered by exposing oneself routinely to positive influences, such as uplifting reading materials, motivating audio programs, and supportive friendship groups. Keep in mind that your path will be distinct from everyone else's, so it is essential that you find the strategies that assist you the most.